What was done cannot be undone. What the United States government did was shameful, and I am sorry.
So what was so significant that the president would apologize on behalf of the entire nation? I'm Jake Choi, and starting in the early 1900s, with syphilis rates sky high, the United States Public Health Service started a syphilis study on African American males.
There were a group of servicemen who came back from World War I, and they were diagnosed as having syphilis. And so for the next 40 years, the Public Health Service followed them and did not treat them. It was uncovered in 1972 by a scientist at the CDC who basically put a stop to it.
When my colleague and friend, Nelson Dorsey, and I found out about this event, we were both shocked. We hadn't learned about them in school, so we decided to go learn more for ourselves. We packed up our bags and supplies and boarded a plane from DCA to arrive in Tuskegee, Alabama. The United States Public Health Service syphilis study took place in Macon County, Alabama, specifically targeting poor African American sharecroppers with syphilis. However, besides the experiments, Alabama was also a major location of the broader civil rights movement. From the Selma to Montgomery March to the Birmingham riots, Alabama was always at the center of things.
What's going on, guys? I'm Nelson with Jake. We've made it to Montgomery, Alabama. Tomorrow we are headed for Tuskegee University and a pretty cool tour.
We're going to actually have the opportunity to speak with Dr. David Hodge, who is a bioethicist, so we look forward to talking to him tomorrow.
One of the first things that Dr. Hodge told us when we arrived at the Bioethics Center, which is where the experiments took place, was that we should not refer to them as the Tuskegee Syphilis Study or experiments.
If you say it's the Tuskegee Syphilis Study, and that's the way it's often said in the media, then the onus and interrogation goes to Tuskegee.
Instead, he told us to call it the following:
The United States Public Health Service Syphilis Study at Tuskegee.
As Dr. Hodge continued to talk, it became abundantly clear why the blame should be placed on the U.S. Public Health Service, not Tuskegee. I had heard that the scientists distributed false treatment in the form of an aspirin pill to African American patients, but there was something else that truly shocked us.
That they set up a surveillance system all the way up to Michigan, where the names of the 623 were on this list and you weren't supposed to treat them, so you couldn't even go to another doctor. At that part now, it is now not just malicious, but it is sadistic, because you are actually trying to help them to stay sick.
Due to the clear ethical violations, the study has created deep-rooted mistrust in modern healthcare among the African American community. What happened at Tuskegee is only one of many examples of how African Americans have been exploited in healthcare. However, Dr. Hodge urges this community to not jeopardize themselves just because of this mistrust.
Black women are justified in being cautious and skeptical about the trustworthiness of the medical establishment, but that just means they should query it more. It doesn't mean they should shut down their healthcare.
In addition to Dr. Hodge, Nelson and I talked with Mr. Jake Williams, who told us about his first-hand experience during the Selma to Montgomery March, and Mr. Columbus Mitchell, who told us about his two uncles who were there on the infamous Bloody Sunday. With our investigation done in Alabama, we headed back to DC. But one question still remained: what is the impact of these experiments on modern healthcare? To answer this question, we decided to talk to Dr. Nicole Rochester, founder and CEO of Your GPS Doc, dedicated to helping individuals navigate the healthcare system. The first question I asked her was whether she believed that the United States Public Health Syphilis Study impacted African American distrust in healthcare.
I think that experiment, that's a part of the current mistrust, but there's ongoing events that are happening every single day that plays a much bigger role.
So what are some of these ongoing events that Dr. Rochester refers to? Maternal mortality rates are highest among African Americans despite them being a minority. Similarly, during the COVID pandemic, African Americans were the most impacted group in terms of death. The list doesn't even end here, so these statistics go to show why there is such a sustained distrust in healthcare among the African American community. In addition to disproportionate treatment, Dr. Rochester cites a lack of meaningful connection as a cause for distrust.
Everybody's typing on their computers and they're not even making eye contact with their patients. So I do think that that's a big element of the mistrust. I think that there needs to be accountability, both at the level of the individual provider, but also insurance companies, hospitals, and pharmaceutical companies acknowledging that they're functioning in a broken system.
The reason Nelson and I initially started this project was because of the COVID-19 pandemic. The Tuskegee syphilis experiments were all over in the news, attempting to explain why African Americans weren't taking the vaccine. While I do recognize the importance of sharing what happened, I believe its portrayal has become a way of blaming historical events for modern distrust in healthcare, rather than focusing on what can be done now. In reality, there are still issues persisting today that cause this continued mistrust. The historical error made at Tuskegee should be something that we learn from, a reminder to keep fighting for health equity.